adrenal glands sit atop the kidneys. Each adrenal gland consists of two distinct regions, which are considered as two separate glands. An adrenal cortex, which is the outer glandular region, and an inner adrenal medulla, which consists of neural tissue. Let's begin with the hormones of the adrenal cortex, or corticosteroids. These hormones are synthesized from cholesterol and thus are steroid hormones. The adrenal cortex has three distinct areas: an outer zona glomerulosa, which synthesizes mineral corticoids, primarily aldosterone. Mineral corticoids are steroid hormones that regulate mineral levels in the blood. There are multiple actions for aldosterone. At the kidneys, aldosterone increases sodium reabsorption and potassium secretion, so it is necessary to help maintain sodium and potassium levels in your plasma. In addition, aldosterone will increase water in the plasma, thus increasing plasma volume. This is due to the fact that water follows sodium as long as the cells are permeable to water. Let's look at regulation of plasma aldosterone levels. There are two primary regulators: the renin-angiotensin-aldosterone mechanism and the levels of potassium in your plasma. Let's start with RAS. Recall that a drop in blood pressure at the kidneys stimulates the release of renin, which in turn will initiate a series of reactions resulting in the production of angiotensin II. Angiotensin II goes to the adrenal cortex to cause the release of aldosterone. A second primary regulator, as mentioned before, is the levels of potassium in your blood. As the levels of potassium increase your blood, this will stimulate the adrenal cortex to release aldosterone. A third factor will be the levels of ACTH. Stress stimulates the release of CRH from the hypothalamus, which in turn will stimulate the release of ACTH from the anterior pituitary. This will go to the adrenal cortex to cause the release of aldosterone. As aldosterone levels in the plasma increase, this will increase the amount of sodium and decrease the amount of potassium in your blood. Increased sodium levels will lead to an increase in blood volume, which will result or can result in an increase in blood pressure. A fourth factor is the hormone atrial natriuretic peptide. This hormone is released when blood pressure is elevated by the atria of the heart. It has an inhibitory effect, inhibiting the release of aldosterone from the adrenal cortex. These four mechanisms will help maintain aldosterone levels, which will be used to regulate blood pressure and sodium levels in your blood. As we move deeper into the adrenal cortex, we come across a second zone called the Zona fasciculata. The Zona fasciculata releases a group of hormones called glucocorticoids. As the name implies, these hormones are involved in regulating blood glucose levels. The main glucocorticoid is cortisol. Cortisol is released in response to chronic stress. Its main targets include the liver, skeletal muscles, and adipose tissue. Its actions include suppression of the immune system as well as inflammatory responses. It does this by decreasing the number of leukocytes and cytokines involved in the inflammatory response. A second action of the hormone is lipolysis, or the breakdown of triglycerides into fatty acids and glycerol, and proteolysis, the breakdown of proteins into amino acids. Fatty acids can be used as an alternative source of energy. The glycerol and the amino acids can be used to make or synthesize glucose. This will increase glucose levels. Using non-carbohydrates to synthesize glucose is called gluconeogenesis. Another action of cortisol is to increase sympathetic input to the blood vessels. This brings about vasoconstriction, which will elevate blood pressure. The release of cortisol is in response to the hormone ACTH from the anterior pituitary. Let's look at hypersecretion of cortisol. This condition is called Cushing's syndrome or disease. Several causes exist for Cushing's syndrome. A tumor on the anterior pituitary can stimulate hypersecretion of ACTH. In addition, medications used for inflammatory disorders, such as the glucocorticoid prednisone, will bring about the same symptoms as seen in hypersecretion of ACTH. Both of these can lead to a condition called steroid diabetes, elevated blood glucose levels, but this is in response to increased levels of glucocorticoids, not a decrease in insulin. Stop the video and try to determine the causes for the signs and symptoms of Cushing's syndrome. The deepest zona or layer of the adrenal cortex is called the zona reticularis. It releases a class of hormones called gonatocorticoids. These are sex hormones. In females, these androgens may be responsible for pubic and axillary hair, as well as sex drive, which is known as libido. Let's look at hypersecretion. In females, hypersecretion of androgens is called hirsutism or adrenal genital syndrome. This leads to masculinization. The breasts will decrease in size, the larynx will grow, the voice will deepen, facial hair will appear, and menstrual cycles may stop. In prepubescent boys, the condition is called precocious pseudopuberty. In these boys, the penis will grow, a sex drive will develop, and secondary sexual characteristics will occur. This is called pseudopuberty because FSH and LH are not being released, thus sperm production does not occur. Now let's move on to the adrenal medulla, located within the core of the adrenal gland. Hormones released by the adrenal medulla are called catecholamines. 80% of the catecholamines released by the adrenal medulla are epinephrine or adrenaline, and 20% are norepinephrine or noradrenaline. These hormones are going to have the same impact as the neurotransmitters by the same name released by the sympathetic nervous system. So let's look at the actions. Epinephrine, and to a lesser degree norepinephrine, since most of what's released is epinephrine, are used to prepare your body to deal with short-term stress. So in this situation, in short-term stress, blood glucose levels will be elevated so that you can use that glucose to produce ATP. This will occur by glycogenolysis. In addition, your heart rate will increase as well as your blood pressure. This is due to increased levels of intracellular calcium. Metabolic rate will increase due to increased ATP synthesis. The bronchioles will dilate. This is to allow more air to get into your lungs so that more oxygen is available for aerobic cellular respiration. And the pupils will dilate to allow more light in so that vision is better. Normal housekeeping processes will be inhibited, such as digestion and the production of urine. The stimuli for the release are exercise, hypoglycemia, which is low blood glucose levels, hemorrhage, which is the loss of blood, and emotional stress.